Hello guys, welcome to another video. This is about Dysarthria, the analysis of Dysarthria. So the correct articulation, it requires correct bilateral coordination of a lot of things. It requires correct bilateral coordination of the tongue, the lips, the palate, the larynx, and the muscles of respiration. Okay, now all these may suffer from lesions of many different places. They may suffer from lesions of the upper motor neuron, of the lower motor neurons. There may be problems in coordinating the influence of the extrapyramidal system, maybe problems in coordinating the cerebral systems, and even the actual muscles themselves, they may be weak. So how to analyze, how to examine? Let's start with how to examine. Then we'll talk about the varieties, and later we'll talk about the causes. Okay, so first what we have to do is we have to listen to the clarity of the patient's pronunciation during history itself. During history taking, listen to patient's pronunciation. Alright, so what if we find some problems in their pronunciation during history taking? Then only we go on testing for dysarthria. So what we can do, how we can test? We can ask them to repeat certain phrases. They can be from anywhere. They can be from a newspaper, or we can use some tongue twisters. Okay, we can use tongue twisters. The best thing is to first start with easy tongue twisters, because the traditional ones which is written in the books, they are really very tough for even normal people to pronounce. Okay, so first we can start with easy tongue twisters, then we can go on to the traditional ones. But for exam purpose, we must remember the names, the tongue twisters which are written in the books and traditionally used. So what are they? One is British Constitution. Another is Methodist Episcopal. Methodist Episcopal. See, even I am having difficulty in pronouncing them. And in case of Indian standards, we can ask the patients to pronounce like Chakravarti Raja Gopalachari. We can also tell them to pronounce Tiruvananthapuram, Muzaffarpur, all these. Okay, I hope you get the idea. Now, what else we can do? We can ask the patient to count successively up to 30. In a single breath. What we will see? We will see the muscle. We will look for muscle fatigue. Okay. Okay. So this is how we examine dysarthria. First, during history taking, we listen to patient's pronunciation. If there is any problem, we ask them tongue twisters. There are traditional tongue twisters like British Constitution, Methodist Episcopal. In Indian settings, we can use Chakravarti Raja Gopalachari, Muzaffarpur, Tiruvananthapuram. Then we can ask them to count successively up to 30, and we can look for muscle fatigue. Okay, so dysarthria, they have varieties. Okay, So what are the varieties of Dysarthria? The first variety is spastic Dysarthria. Okay, spastic Dysarthria. How it is caused? It is caused by bilateral upper motor neuron disease. Okay, caused by bilateral UMN disease. What will happen? Here the tongue will be small and obviously spastic. Okay, because of bilateral upper motor neuron disease. The speech will be slurred. There are some letters which will suffer particularly. What are they? B, P, D and Y. These letters will suffer particularly. And if we see the jaw jerk and pharyngeal reflexes, what will happen to them? Remember, these are upper motor neuron disease, so they will be exaggerated. Alright, so this is spastic dysarthria. What are the causes? Number one cause is all are upper motor neuron disease. Number one cause is pseudobulbar palsy. Another one is stroke, maybe multiple strokes. Okay. Another thing is bilateral, upper brainstem tumors. Okay, so these are the causes of spastic dysarthria, all upper motor neuron types. Okay, so another variety is, if we term it one, the second variety is hypokinetic dysarthria. Hypokinetic dysarthria. What happens here? It is a result of extrapyramidal lesions producing rigidity of face or tongue muscles. Okay, it is because of extrapyramidal lesion which will cause rigidity of face and tongue. Okay, there will be no wasting, there will be no exaggeration of reflexes in this case. Alright, no wasting, no exaggeration of reflexes. Like in this case, jaw jerk, pharyngeal muscles, they were exaggerated. Okay, and tongue was spastic and wasted, small. Okay, this will not be there in hypokinetic dysarthria. This is a feature which differentiates it from spastic dysarthria. What will happen though is speech will be monotonous. Okay, it will be monotonous. All accents will disappear. And sentences will start and stop abruptly. Alright, so what were the causes? What will be the causes of hypokinetic dysarthria? Can you understand from this? Extrapyramidal lesion, rigidity of face and tongue, okay, and monotonous speech. It's very easy. It is Parkinson's disease. Okay, so there are two more types: Dysarthria varieties. We've already discussed spastic. We've already discussed hypokinetic. Now let us discuss the third variety. It is ataxic. Ataxic dysarthria. What happens here is there is incoordination of the muscles of speech, including the respiratory muscles. Okay, incoordination of muscles of speech. What will happen? Speech will be irregular, drunken, sometimes too loud, and sometimes maybe too soft. There will be jerky rhythm. Okay, something happened during recording, and I just went on with my rhythm, and then I saw that recording had stopped. So, okay, ataxic dysarthria, there will be jerky rhythm, and think of a drunken person. Okay, in case of ataxic dysarthria, the speech will be of a drunken person. Causes are multiple sclerosis, cerebellar disease, or tumors. Note, it will be cerebellar disease, not cerebral. Hereditary ataxia is a cause. Phobias and drugs like anticonvulsant drugs and alcohol. Alright, now the last type, that is fourth type, that is flaccid dysarthria. So lesions in flaccid dysarthria will be in the lower motor neuron and in the muscles. Okay, there is no story of upper motor neurons here. Alright, the speech as a whole, it may be preserved, but what will suffer is individual words and individual sounds. Okay, there will be particular there will be variety in the weakness, but individual sounds will suffer. Say there is facial nerve palsy. Okay, that will cause facial paralysis. Facial nerve palsy is a lower motor type of disease, lower motor type of facial nerve paralysis. So in this case, the labials will suffer. Okay, I know this is tough to remember, but the labials will suffer. What are the labials? Like B, P, and M and V. Okay, in case of tongue paralysis, so it's happening again and again. Alright, I'll continue. Tongue paralysis, I, D, S, N, T, etc. A large number of sounds will be affected. Okay, and in case of palatal paralysis will produce nasal speech, and sounds like B and D, like B and D, will become Ma and Na. N, that is Na, will sound like Ra. K, that is Ka, will sound like Nga. And another interesting thing is that in case of palatal paralysis, the position of the head alters the degree of the defect. If the patient's speech being worse, there is a patient's speech will be worse when the head is bent forwards. Alright, okay. Another last type of dysarthria I want to talk about is the mixed type of dysarthria. It is a combination of any of the above. Okay, combination of any of the above type of Dysarthria. Maybe flaccid and ataxic may be combined, spastic ataxic may be combined. Okay, so that was all. We talked about Dysarthria, we talked about how to examine, then we went on to discuss about the varieties. There are 4 or 5 varieties basically: spastic, hypokinetic, ataxic and